and thank you to the wonderful speakers and the panel right before me. I love that Dom just closed with how important data is for advocacy. And so we will hear about 3 examples that will be sharing specifically how we can advocate to close the gap. So the goal of this panel is to discuss successes in how we bring the gaps for patients and families through advocacy, also to discuss lessons that we've learned through those experiences, and some ideas for how to move forward. And especially we want to discuss how important collaboration is, continuing the theme from the previous panel. So I would like to introduce the two of the speakers that we have right now. First is Audelia Villarreal. She is also from Mexico. She's director and founder of Ayuda Corazón de Niño in Mexico, which is an NGO that supports treatment of children with congenital heart disease. However, Audelia has extremely interesting experience in advocating for newborn screening in her country. She's been involved both at the national and the regional level, actually ultimately culminating, her efforts culminating into passing a mandatory newborn screening for congenital heart disease in Mexico. She's a book author that she used for her advocacy efforts called Diego and I Go to the Hospital, that promoted cardiac screening in Baja California, where she practices and lives. She actually helped passing, as I said, the National General Health Law, which was amended to include newborn screening. And she also has been a senator twice in the Republic of Mexico. Our next speaker is, I'll present them and then I'll give them the stage to give their presentation. And our next speaker is Mark Roeder, who is the president and CEO of the Adult Congenital Heart Association in the United States. He is responsible for ensuring the overall management, strategic direction, and financial well-being of the organization. But Mark, prior to joining the ACHA in 2017, he actually served in executive leadership positions with 2 other organizations, Susan B. Komen Breast Cancer Foundation and the National Multiple Sclerosis Society. And earlier in his career, he managed also marketing for Fortune 500 corporations. But he has more than 35 years of experience, specifically with government relations and legislative advocacy at the local, state, and federal level in the United States. And so both of them will share some thoughts from their experiences, and then I'll have a couple of minutes to share an effort that Children's HeartLink and Global Arch have been undertaking. So Audelia, the floor is yours. You should be able to share slides.
Thank you. Thank you. Okay, you see my screen now?
Yes, yeah, you just need to put it in presenter mode.
Yes. You have it.
Now, thank you. Yep.
Okay. Well, thanks to Global Arch, thanks Pistra, for this great opportunity of being together today and share with this Advocacy Matters with you and Mark. So, good morning, everyone. I am Audelia, and I started my way into congenital heart diseases 30 years ago because as a mother, I had to walk through it. And I thank God because Diego, my older son, who is almost 31, he's healthy. And also Camila, the youngest, who is 20. And both of them are a great human being. So the way to practice my gratitude is helping other kids become healthy adults so that they can achieve their own dreams too. So advocacy is a great path to make it happen. So please see the following video.
Corazón de Niño has positioned Baja California Sur as a pioneering state in the implementation of newborn screenings. Thanks to our intervention in 2015, we became the first state in Mexico to establish critical congenital heart disease, CCHD screening as a legal right. In 2021, we achieved national recognition for this initiative with its publication in the Federation's official gazette, making it a universal right for all newborns across Mexico. 10 years after the beginning of this journey, we proudly affirm that CCHD screening is imbued with a child's heart originating in Baja California Sur and now embraced nationwide. Throughout this work, we have witnessed the profound impact of newborn screenings as a powerful means of promoting equality at birth and upholding children's rights. With the recent release of the updated National Health Card, which includes the registration of 5 screenings, we have developed a comprehensive training model. This initiative will facilitate the standardization of procedures, techniques, updated methods, and best practices for healthcare providers nationwide. Our training model, guided by expert instructors in each area of screening, can be deployed to every region in the country, offering essential knowledge that fosters best practices and significantly enhances the future health outcomes of at least 137,371 newborns annually in Mexico.
Well, advocacy is like running an ultramarathon. In our case, after 10 years of pushing for pulse oximeter screenings in Mexico becoming a standard, I can say that in our race, we may have gotten the first kilometer, which means that in 2021, all the Mexicans have got the right to eat, as you saw in the video. So the other 99 kilometers will be completed when the screening and the coverage of CHD treatments are at least 80% in our country. So I would like to talk about our race and the achievements that we have had so far from the perspective of an NGO that has developed its own intervention model based on evidence. We see ourselves as a solution factory. We receive a problem, we find a way to solve it once, we see what can be improved and reiterate. Then to do it efficiently, we must do a deep analysis on which of those problems can be solved through advocacy to bring these solutions to every citizen in our country. So picture in your head a night sky. There are 1,000 of stars. However, each one represents a different problem. Which star is the brightest? Which star is the one that we pick to solve first? Which star shall we choose in Mexico? We draw and write all the problems and situations that affect the fact that we have a very low coverage and the lack of timely open heart surgeries regarding the worldwide estimations of the incidence of congenital heart defects versus the birth numbers in Mexico and the available capacity of the public health care, we estimate that only 30% of children will have the surgery on time in our country. Then we interconnected the problems, and as a result, we found in that sky full of stars, the constellation that burns the brightest. In our case, we found that the lack of a proper budget was the key to work on. After that, we developed a strategy that defined the steps to start our ultramarathon. You see now an exercise that shows the analysis and the definition of our first task to take the advocacy field. We found that the pulse oximetry screening and a national registry for CHD were the next checkpoint in our race, as both of them would tell us what is missing to do and will be the right tool to ask for the appropriate public health care budget. But really, we need to understand the language so that our approach is successful. So we wrote and pushed a formal proposal in 2018 to the Senator Chambers, backed by a study reflecting the cost effectiveness justified through children's rights written in our Constitution and secondary laws. We got pulse oximeter screening as a right for everyone in 2021. For those years, I had the honor of being a senator This enabled me to understand even further the short and long-term vision on public health from politics side, while using the right language to keep the topic in the loop. So please see what we have accomplished while running our first kilometer. We got the universal right national so that every newborn in Mexico receives the pulse oximetry test before being discharged from the hospital. Please see the following video.
En este sentido, en el mes de septiembre, participamos en el foro hacia la construcción de la norma oficial mexicana para la aplicación del tamiz neonatal cardíaco, en donde grandes personalidades hablaron del liderazgo en nuestro país, en América Latina, al tener la legislación y la normalización de este tamiz. Entregamos a la Secretaría de Salud Federal un documento firmado por 100 expertos para promover del análisis costo-beneficio de la implementación del tamiz cardíaco, elaborado por el Comité de Especialistas, que demuestran que
México podrá salvar la vida de al menos 1,000 niños y niñas cada año y ahorrará, escuchen bien, 12,000 millones de pesos tan solo en los primeros 5 años, al evitar todas las complicaciones que hoy se atienden por la falta oportuna de diagnóstico.
And yes, because of the pulse oximetry screening, Mexico is now in the way of saving 1,000 lives every year, while also saving 12,000 million pesos in 5-year time span. And it could be redirected to the open heart surgery chapter. The legislative and the executive power and either federal, state, or local of the government of Mexico are talking about congenital heart diseases. The hospitals in the country, as it is a law, have had to upgrade their equipment for detection and diagnosis, changing the reality of detection of CHD and also other pediatric health problems. We have a national health card, a new national health card for all Mexicans with this right printed, so the families have in their hand an official document that informs that 5 newborn screenings must be done during the first month of life. We have a new and official national training model for newborn screening that are written in the health law. And we are placing the critical congenital heart defects into the table of public health and budget discussions. It's been a long first kilometer, but Corazón de Niño is not running this race alone anymore. It's found other runners that were interested to get the pulse oximetry screening on their own. Running an ultramarathon, it's hard. It's better to have company. While racing, we were able to found the National Cardiac Screening Committee and the Latin America Cardiac Screening Committee, where more than 50 relevant and specialized professionals have worked to document very serious information to achieve the best medical practices in Mexico and a strong training program. There is still 99 kilometers to go. We will be stronger because the accompaniment of these great professionals and committees. The next stop or checkpoint will be the National Registry, for which we are working on an investigation project with a specialized group that will justify to our authorities the need for the registry. And then we will have official numbers instead of only estimations. I strongly believe that we are heading towards the finish line. There is still a long way to go, but I know Corazón de Niño is making the difference to build a better future with hope and equal access to on-time treatments for all. We will cross the finish line once open heart surgery and treatments are accessible for every child in our country. Again, every child, no question asked. So please, if you are working on advocacy, find your constellation, make a plan, define your route. At some point, every single part of your body may hurt, but as long as you are still moving, you are on the path to success. So please Don't get tired. Thank you.
Well, so inspiring. Adelia, this was wonderful presentation and wonderful story that you're telling. Thank you so much for sharing with us, and I hope it's inspiring not just me but everybody else here on the summit, attending the summit, to find their constellation and make their path forward. Thank you again. So we will have time for questions in a little bit, and next I would like to give the floor to Mark. And he will share about his experience with doing advocacy in the United States. Mark, the floor is yours.
Great, thank you very much, Bistra, and thank you also. Great presentation, Adelia. Let me see if I can share my slides. Okay.
Yes, we can see that.
Great. Well, love speaking about this topic, and advocacy, as certainly the other presentations yesterday and today have talked about. Advocacy comes in many forms, and specifically what we're talking about here is legislative advocacy and working with governments. And oftentimes people say, well, why is ACHA, the Adult Congenital Heart Association, why are we so involved with advocacy work? We also are involved heavily with education and accreditation in the United States, and funding research ourselves. But what makes advocacy, federal legislative advocacy, so different is that this is truly how you bring about systemic change. And the plain fact of the matter is that it's important for us to always keep in mind that the individuals who are often in the position of making policy and funding decisions really are going to know very little about CHD and its impact on individuals' lives. And so we are the experts, right? We are the ones whose job it is to help educate lawmakers. And in the United States, that's an ongoing process, because of the fact that our House of Representatives basically have elections every 2 years. We often kid that the first 6 months they're in office, they're just trying to figure out the halls of how to get around the Capitol. And the last 6 months in office, they're running for re-election. So you really have sort of a 1-year period to try to get their attention. On the Senate side, they tend to be in office longer. Those are 6-year terms. However, we have just seen dramatically so much more turnover, even within the last 10 to 15 years in these positions. And so what I often say is, if you're going to be in legislative advocacy work, you have to be in it for the long haul. And I love the phrase that Adelia just used of ultra marathon. That's exactly correct. So we don't have time today to talk about many different pieces of legislation. So I wanted to focus on what truly has been sort of the signature federal legislation with regard to the CHD community. And it's the Congenital Heart Futures Act. And I know Amy worked on this act extensively when it was initially introduced back in 2009 and was passed into law in 2010. And our organization partnered with several other patient advocacy organizations to really help write the legislation, to rally the support, and to truly motivate stakeholders to help move its passage forward. And what this act was, why it was so important, it was the first federal legislation that specifically set aside funding within the United States budget for CHD research across the lifespan at both the National Institutes of Health, as well as creating surveillance systems within the Centers for Disease Control. The initial authorization was roughly $4 million, was funded at the start at $2 million, and then eventually achieved that full authorization of $4 million a few years later. So with legislation of this type, when it's an authorization, they always have an expiration date, if you will. And it's usually either a 5 or a 7-year expiration date. And so what that means is that we have now had to go back to Congress twice and try to have the act reauthorized. And so I was fortunate to be very involved with the reauthorization in 2017, as well as with the current reauthorization in process right now this year. And what we have tried to do each time we've gone back for reauthorization is to try to either increase the funding level so that more research can be done, or to add a new element to try to enhance what we're able to offer to the community. And so in 2017, we were able to up to authorization level to $10 million. That was a significant jump, and has certainly helped to fuel many additional surveillance and population-based studies at the CDC. And again, you know, within the United States sort of budgeting system, there's a very distinct difference between authorization and appropriation. And so we have to go back every year and continue the fight on Capitol Hill to try to get the actual annual budget to be as high as it can possibly be for funding. And so we started again with this round at $4 million in annual funding, and now we have it up to $8.25 million. So we're still not at the full authorization. So we need to keep pushing forward. Now in 2024, and the other thing that was new in 17 was the bill had language that required the CDC to implement an education and awareness campaign. That was critical. Awareness continues to be such a huge challenge here in the U.S. in terms of CHDs in general, but especially the adult CHD population, this expanding, growing population. And this year, with the current reauthorization, we decided, again, because of the current climate in Washington, to maintain funding at the $10 million level. But what is new this year is a requirement for the Department of Health and Human Services to investigate the ACHD workforce challenges. And I'll speak a little bit more to that in just a minute. So what's absolutely essential in making any legislation move forward here in the United States is that you have dedicated, committed champions. And we have been very fortunate since day one of having two individuals, Senator Richard Durbin and Representative Gus Bilirakis, who have been 100% working hand in hand, arm in arm with us. And they have continued, whether it was the initial Futures Act or the two reauthorizations since, they have continued to be our primary champions. And we're just so grateful for all of their efforts. As you can see, we've also had several other co-sponsors along the way. And, you know, the D and the R stands for Democrat and Republican. What's critical in the US is if you are especially trying to get patient advocacy legislation passed is that you have bipartisan support. Right now, the United States, there is a lot of partisan politics in play, and that's just the reality. And so we have always really made it a priority to try to seek to have truly bipartisan support to keep the legislation moving. A consistent theme throughout yesterday and today has been obviously collaboration and partnership, and you don't want to operate in silos, and you don't want to go it alone. And that is especially true when it comes to legislative advocacy in the US. Definitely there is strength in numbers throughout this work. It has been many different organizations that have partnered together. I know over the last 8 years that I've been involved, these are the 4 patient advocacy groups that have been working together to align our messaging, to align our stakeholders. And then also the last organization down there, Cura Strategies, is the public policy firm that we work with. And that's important as well, that you have somebody within, for us, it's Washington, D.C., but somebody who is regularly always in the halls of Congress and is hearing the conversations that are taking place and can help us to shift and move as we need to. So this just shows what has happened, the success story of the funding for CHFRA through the years. Again, the initial funding, first funded in fiscal year 12, was at $2 million. It's now at $8.25 million. It was just reappropriated and for fiscal year 2025 at that same level. So our goal is to obviously see the increase continue to grow and hopefully grow even more dramatically. but certainly proud of the progress that has been made. So I mentioned before a little bit, one of the things that's new this year, we about 2.5 years ago started having conversations on the Hill for separate legislation that would be around a separate budget line to specifically try to address the significant workforce shortage issues when it comes to adult congenital heart disease cardiologists here in the US. So we roughly have a population of 2 million adults living with CHD, and we have about 500 specially trained board certified ACHD cardiologists. And so there's many different ways that you try to address this issue. And one of the options is clearly on the legislative side in terms of, are there additional fellowships and grant opportunities, things like debt forgiveness, right? And so we started working on separate legislation. And in regular, basically weekly meetings with our champions on the Hill, it became clear that this was not the climate to introduce new budget lines. And so what we were able to do instead was to say, okay, we won't introduce new legislation at this point. We worked language into the existing bill that now requires Health and Human Services to basically to do an analysis, put together a team of experts that will include many of the folks from the patient advocacy organizations and the medical professionals, and explore this issue and then issue a report to Congress. Why is that critical? That opens the pathway for future funding in this area. Very quickly, this just shows sort of the pathway to passage for the 2024 CHFRA. This was actually a very short pathway. We basically had introduction in February, and then it made it all the way through passage through committee, subcommittee, and then both houses of Congress by September. And right now we are just, awaiting the president's signature. That's actually a very fast accelerated time frame. And largely that was because of the decision to not go for additional funding, to go for level funding. If we had gone for additional funding, we would probably only be at about step 2 at this point in the process. So it's just understanding what the climate is as you're advocating. So the role of patients, medical professionals is critical in all of this, right? We all know that. And part of this is, how do you make it reasonable and easy for them to participate? And so, our 4 patient advocacy organizations, we all partnered together on templates that letters that could be easily generated and sent to elected officials. I'm pleased to say that we had, during this most recent CHFRA, we had more than 7,000 letters that were sent to elected officials. Social media posts. All of the partners were regularly, especially during the time frame where it went from committee work to then full review within the House and Senate, promoting heavily on social media, encouraging their stakeholders to reach out to their elected officials, and then in-person Capitol Hill visits. I know that during the past year, I've been to Capitol Hill 8 times. And it's the picture that you see there basically shows us meeting with Senator Durbin, but in that picture, you also have 2 patients and 2 medical professionals. So it's the teamwork, it's bringing in the experts as well as the patient stories that make it happen. So I know we're going to talk about this more in the panel discussion, but just very briefly, I'll just sort of mention. So what are the key learnings? As we've talked about, align with other organizations who share the same goal. Provide easy to use opportunities for people to engage. When we put out the rallying cry to our population to send letters or to do virtual visits, they respond. Right? Our constituency wants to be involved in this type of work. The combination of patient stories and provider expert opinion. As I mentioned, understanding the current climate. When you are going to meet with an elected official, make sure you sort of have an understanding of what's going on, right? And that's just so critical. You don't want to go in and asking for something that looks like it's, beyond the moon and the stars, because that then becomes very easy for them to say no. It's all about compromise and trying to move things forward. And it's a long pathway. And know that there are going to be potholes and just, again, it's that ultra marathon. And then the last thing I'll just mention that I know that all of our patient advocacy organizations were focused on, it was sharing many wins. Like, you need to keep your constituents excited about the work of trying to make this legislation pass. And so every time we had a subcommittee vote, every time we had a committee approval, we would promote that. We would make sure that our constituencies knew that and keep them focused on the end game. So I will stop there. And I look forward to being able to answer your questions in the panel session.
Thank you, Mark. Very inspiring. Be prepared and constantly celebrate the small successes even. So really, really important work. I hope I'm certainly learning from what you shared. So I will quickly share a little bit about the Global Coalition that Children's HeartLink and Global Arch are co-leading. And let me just share my screen here. It is an effort that probably quite a few of you already know about, but we wanted to make sure that we talked about it because it's advocacy at a little bit different level. Make this in presentation mode. Okay. So apologies for this. The Global Coalition for Pediatric and Congenital Hearts was started in 2023 after the 8th World Congress, which was the World Congress for Pediatric Cardiology and Pediatric Cardiac Surgery. I think many of you were there because Global Arch again organized another summit, which was in person. This is actually the first virtual summit that Global Arch is organizing. The coalition right now has 124 members from 44 countries, 80 individuals, as you can see, 44 organizations, and 28 of those are patient and family organizations. And so it's currently hosted by Global Arch and Children's HeartLink, which is the organization that I work for and represent. And so what does the coalition do? The mission of the coalition is to reduce global inequities in access to quality pediatric and congenital cardiac care through collaborative advocacy efforts. We would like to do that through different important stakeholders engagement, similarly to the presentations we just heard about, and providing education and communication and awareness that Mark highlighted, that you constantly have to build that. Our goal also is to improve diagnosis, treatment, and lifelong care through enhanced global and national policies and increased investments in services for pediatric and congenital heart disease. As I said, the Global Coalition is hosted and managed by Global Arch and Children's HeartLink. Global Arch is the actual secretariat for the coalition. And so we work closely with the two organizations, work closely to do events and on some specific advocacy efforts. And so we wanted to grow basically the coalition through inviting others to join it. And I'll share a little bit about what our first big global advocacy goal is. But when people could share their contacts, sign a call to action that was promoted during the World Congress, which I believe all of you here who are present today have signed on, joining the coalition. We also have, we'll have a call about the coalition in December. And we want to inspire everyone to advocate with their governments and to raise awareness. So the 2024-2026 goal is a World Health Assembly resolution on pediatric and congenital heart diseases in care. And what is a World Health Assembly resolution? This is a document basically that member states of the United Nations and represented in the WHO, in the World Health organizations, sign on to and make some specific policy commitments to make health policies in their countries. This, as I said, this resolution will be based on the call to action that we had promoted during the 8th World Congress. And the call to action, I'm showing this here, and in case someone has not signed on, we always accept new signatures. So here is a QR code if you would like to do that, and if you don't remember doing it. But what the call to action and what we feel will be the basis of this resolution are these 4 asks. One is increasing capacity to care for people with pediatric and congenital heart disease, building the pediatric and congenital cardiac workforce, closing the data gap. We had such an important conversation about data earlier this morning, and financing pediatric and congenital cardiac care. I would say that's probably a problem absolutely everywhere around the world, is the lack of financial resources. As I said, what is a WHO resolution? It is actually a formal agreement or decision by member states of the WHO for political commitment on specific health topics supporting technical policies set by the WHO. So a WHO resolution is this document that all countries agree on, but also it promotes a specific, very important role of the World Health Organization that will be providing and will be convening the technical experts. And so we believe that it's time for us to be thinking about what is a separate policy, a separate global strategy for pediatric and congenital heart diseases. You are all here because you care about this topic, and we're talking about advocacy. And so it will be one more document on which we can be advocating within our own countries to be developing policies for pediatric and congenital cardiac care. A little bit more about the resolution, as I said, very similar to the call to action: increasing capacity, building pediatric and congenital cardiac workforce, closing the data gap, and financing. And I think that's it for me. I hope I was able to give a little bit more of an overview of what we're doing, and maybe now I can invite Mark and Audelia to join me on the panel here, and we can ask some questions. And I would welcome everyone who's in the audience, if you have questions, to put them in the group chat box. So I know Mark and Audelia, both of you shared that some of your lessons, and I actually took a lot of notes: be prepared, constant communication, awareness building. First of all, you heard each other's presentations. What lessons would you actually share of really practical aspects of how do you do advocacy, and how do you engage others, and also what you heard from each other? I think that I'd be curious to hear your reaction. So Mark, why don't you start, and then next Audelia.
Sure. Yeah. Thanks, Bistra. I mean, first thing I learned is I'm gonna start using the term ultra marathon. I really like that term that Audelia uses.
Me too.
I think that making it very practical, especially for stakeholders, is so critical. And one of the things that we have found, even to the point of providing talking points, right, and making sure that if you're asking people to go and do virtual visits with elected officials, or in-person elected officials, how do you help keep that whole core of sort of volunteers on point? And so it's critical that you arm them with like talking points, and you want folks to feel that they have the leeway to share their own personal story, because that's what brings the emotion and the passion to the work. But ultimately, at the end of the day, when it comes to the actual ask to the elected official or their legislative aide or their health aide, the person you're probably going to be meeting with, we need for everybody to be making the same exact ask. And so that's critical. I've unfortunately seen situations where very well-intentioned and well-meaning volunteers can kind of go off point. And then it becomes very, very confusing to the elected officials. And the thing to always keep in mind when we're visiting Washington, D.C. as well, is that these are incredibly busy people, right? And so they're usually in the midst of taking 8, 9, 10 meetings that day. They're meeting with different organizations. They're hearing about all different types of health issues and other issues in terms of environmental issues and economic issues and whatnot. And so make sure that you leave them with a very, very clean, like, what exactly is that you need from us? And then, you know, the sort of normal courtesy things, follow up. Like, we ask all of our folks, hey, after you've had this visit, within 48 hours, send a note thanking the person that you met with, ask them if they have questions. Interestingly, quite often you will get a response back and there will be additional questions, right? And that begins then a dialogue, a communication. That's actually how we've gotten some of our newer champions is just through that follow-up procedure. So I would just, you know, say a couple of those really basic sort of courtesy things.
Wonderful. Adelia, you were a senator, and I'm sure you have both experiences as an advocate, but also when people came to you with their asks. I'd love to hear your perspective.
Yeah, thank you, Bisra. Well, what says Mark is the truth. It's people very busy with many things to attend, many different problems and very, very different needs, and even in the country, because we are watching and we are focused on our things to say and the problems that we are seeing, but in the same intensity, there are many people talking about their problems. So I strongly believe, and since my experience as legislative in the politics side, as easy is presented and as very well built is presented, it has more possibilities to be picked up, to go through in the politics side. We cannot go there and ask for something that is just an idea or is not well built. It needs to be very, very well done, and it requires a lot of work, a lot of effort from our side. Talking now about NGOs, it requires a professional work. It's not enough to say, believe me, this is a hard issue. No, that's not enough. We need to build something strong to go and to be in the first line or in the first topic to be picked up for the legislative side. So I believe that we should be ready for that moment, and I strongly believe that we need to understand and we need to ask to the right people, and we need to go and build a team with the right and professional people to build something strong and to understand the time that we are living. For now, for example, in Mexico, we just changed the government and the federal government, and the US is go through that moment. And we have a different system, but anyway, the change of a government brings a big opportunity for everybody, and the NGO needs to understand that. And I agree with Mark when says provide easy to use tools. That's one of the main keys to work on this. And I think that one of the most important keys or things to do is we must to believe that is going to happen. If we don't believe, we won't convince anyone. And it will take a long time. Yes, we know that. But step by step, as Mark said, we will have little wins, a little things to share, good things to share. But step by step, we are winning because we are in that different position that we were before. So that's so important to keep it value and to understand that we will continue working and bringing more people engaged, and professional people engaged to continue this advance or this approach to the laws. I believe it's so difficult, and in the meantime, it's also the difficult side of this is that we are seeing, as an NGO, we are seeing the problems, and we don't want the inequality happen. the politics side is so intense, so big, so difficult that it's so slow for this need. But that's the way it is. So we need to be patient, but constantly keeping the same way. So that's what I have to share.
Thank you. These are amazing comments. First of all, the fact that you both highlighted that you need professional help for this, and not that doesn't mean necessarily professional advocates. You can be that, but you need someone who has professional communication skills and someone who can help you hone your messages. I think that's such an important point that we often forget, because we are very passionate about our causes, right? And we believe we're right, that's important. That's an important thing for our society, but that's not enough. We need to be putting all this effort into making this a successful advocacy campaign, advocacy ask. So very, very helpful comments. And I love what you said, all right, Odelia, again, we must believe, you must see the end of this ultra marathon that you both talked about. So I want to move to a next question. And you both talked about partnerships. Mark, you said 7,000 letters. No one organization can send 7,000 letters and many thousands of social media posts. Tell us about how you leverage partnerships for your campaigns. And this time I'll start with Odelia.
Oh, okay.
Odelia, yeah.
Okay.
Sorry.
Well, it's different in Mexico, but I think that just talking to the people, to the right people, that the decision maker people, and sometimes you need to look for the moment, the right moment, to talk about and to keep everything with you ready in a easy tool to use, as Mark said. And that's the only way to do it. Don't get tired, find the strategy in the moment and be ready for that. It's difficult to have a formula, how it's gonna work. But as I also told in my presentation, to running the marathon together is easier than running alone. And in our case, we are running with a lot of medical people, very science people that has given the very serious information to share, and changing that information to the right language. That's what I said about the right language, and to bring those information, that science information, to the right side of the children. I believe that's the best way, and that's the better result that we have get in the process.
Thank you. Mark?
Yeah, and one of the things that helps us with this collaboration around this work, Kathy, Dr. Jenkins mentioned earlier about the Congenital Heart Public Health Consortium. And so interestingly, part of the funding that is raised through this legislation is what funds the consortium moving forward. But the 4 organizations who are the primary patient advocacy groups working on this legislation, we're all active members of that consortium, right? So we're partnering and learning from each other and hearing about each other's programs and activities on an ongoing basis through that effort. And so I think that helps us then when it comes time to really rally the forces and say, all right, we need to be working together. There's already a level of relationship there. So one of the things that I think is critical is that you figure out how to form a relationship before you have to get into the heavy lifting of work, right? And then what I would mention is that each of our organizations, we have our own style and words that we use and focus when we're talking to our constituents. What's critical is if you're trying to put together shared tools for everybody to use, everybody has to be willing to maybe give or take a little bit. There may be, some language that may not be the exact way that ACHA typically communicates, but it is what makes sense for this particular. And so you have to be willing to really compromise and then lean on each other's strengths. We had one particular senator over the summer who was holding up, we were trying to pass the legislation through what's called unanimous consent, which is just a procedure that Basically, if you can get senators to agree to just, we're going to fast track this through, and it's a quick sort of hotline vote of yes or no, right? And pretty much we got it through all senators except for one who was holding it up and was adamant that he was not going to provide the funding. In his particular state, ACHA did not have a lot of representation, but one of our partner organizations had a very strong constituent. And so we were able to activate that individual. That organization reached out to that individual who activated it, and then we went together on a visit to that office, and then that helped to get the process down the road. And 2 weeks later, we were able to get it through committee. So that's where it's important to be able to just lean on each other and utilize those resources that each of us have.
Yeah, wonderful. And obviously, I followed your work. It's always interesting to see it from different perspective. I've seen how some of the professional societies engaged in this, and I can tell you, they did see the patient and family organizations as the leaders in this process. So really fantastic work. Also, I have to say, I believe Emmy Verstappen was there when this first was being introduced. Fantastic name, Futures Act. Who doesn't care about the future, right? It's really a great name that has stuck, and I think it's wonderful. It's going to be hard to not sell people on the future, on a good future for everybody. Okay, so we are close to wrapping up. I just want to have one last question, if the two of you can comment. What do you see as the most crucial next step for engaging patients and families in advocacy and in getting governments engaged and in getting people to notice this topic? We clearly are many of us, but we're small. What is the crucial step? Mike, why don't you start, and then Audelia.
So I'll just mention two things very briefly. One, Audelia mentioned that the U.S. is getting ready to go through a complete turnover of the administration, and so it will be absolutely critical over this next year ahead that we're able to really mobilize our community to get out and meet many of the new players. There are going to be a lot of new players, and that opportunity to educate is going to be critical. And candidly, to be fighting for our fair appropriation, because we just do not know when we get into the actual annual budget season what to expect. So that's going to be critical. The other thing, and this goes back to the first session this morning, we have to get more data. Fortunately, we are now starting to see some data come through from the research that's been funded already with the population studies that CDC is doing, and but we need to elevate and escalate what we are doing in terms of data collection. And there's a variety of different fronts for that. We're also involved with something called the Congenital Heart Initiative, which is a registry program, and we are actually getting ready to launch data through our accreditation structure and system. And so that's the next critical step, is that we have better and better information to be able to arm our patients when they're doing these visits and when they're doing the outreach, so that they've got really strong data points to be able to talk to.
So you are saying patients, patient advocates, become an advocate, reach out to your representatives and reach out to you to know what they say and how to support these initiatives, basically.
You said that much better than I did. Yes.
Audelia, what do we need to do? What are next crucial steps for patient advocates to continue to engage with governments?
Well, in Mexico, I am sure that the National Registry, in the official site, is our next step. We need that to ask for the right budget, because right now we are just have estimations. Obviously, we can have those estimations very close because there are international numbers publicated, but it's not Mexican numbers. So we cannot go to the legislative side and say we are missing, that's our estimated, we're missing 8,000 children every year. So we cannot do that because we don't have the official numbers, and they have the right answer. It's not official number. So we cannot allow that answer. So we need the National Registry to then change the way that Mexico is going through. And that makes sense with what Mark says about data. And I believe that even in the international side, we need to find a way to communicate in an easy tool the data that we have. And that could help us to the countries that we don't, even I believe that many countries does not have a national registry. In the specific case in Mexico, I believe that we do need it, but the international data should be translated to easier things to understand, not for us, I believe, for the for the politics side. That's what I think that we should go through.
Thank you. So very similar answer. You know, you obviously have a specific goal of wanting to start a registry in your country, and so engaging people to be asking for this and to be asking for a budget for running a national registry. I want to also add that our global efforts with the World Health Assembly resolution do not negate any national efforts and national advocacy efforts. So I would invite your organizations and your national level coalitions to join those efforts, because we can be making exactly the same asks, and we're talking probably to the same governments, right, to support something at a global level and then translate it how it translates into a national level. So I am so glad I heard your stories, and I'm glad that Global Arch invited you to come and speak about this, because I learned so much. You know, how critical partnerships are, how critical data is. We continue to talk about this, how critical patient and family advocates are to share their stories, joined by the clinician voices, by the professionals who are doing this work, so we can make one clear to communicate coherent message and engaging as many stakeholders as possible. Thank you so much for this really, really lovely discussion. Kate, I'll pass it over to you.
That was absolutely wonderful. Thank you all. Before we wrap up this panel, I'm actually going to ask you a question, Bistra. You've worked with many governments in your role at Children's HeartLink and for advocacy efforts. Was there any key lessons learned in working with a variety of different governments and ministries of health, and anything you wanted to share about that as well?
I think that everyone likes to be heard. That's giving an opportunity for people to share what's important to them, and then see where those connections are with the goal that you are advocating for. That's what I would say. That's my biggest learning, is when we meet someone to not go immediately and say what we want. And I think Mark alluded to that as well in his presentation. We certainly have a goal. They know why we're there, but to always first listen to people and then try to find, through listening, try to find the common points. I would say that's one thing that I would say, that which is very human, right? It's not just government.
Thank you. Thank you.